Hello, today I will be talking about cystic fibrosis. Cystic fibrosis is the most common inherited disease in developed countries. Cystic fibrosis affects the lungs, the pancreas, the sweat glands, and the reproductive organs due to problems with water and salt movement from cells, which results in salty sweat and thick mucus. This mucus can stick to organs and makes it difficult for the body to clear it out. Two organs that are especially negatively impacted by the mucus are the lungs. As we can see here, there is lots of mucus buildup in the lungs instead of it being clear, which can make it difficult to breathe. In addition, the pancreas is very negatively affected, and that can result in problems with absorption of vitamins, nutrients, and minerals. Cystic fibrosis is caused by a mutation of a recessive gene, which means that it must be inherited from both parents, either by parents who have cystic fibrosis or by parents who are carriers for cystic fibrosis. As I said before, this mutated gene impacts how salt and water move into and out of mucus-making cells, and this results in the mucus being thick and sticky. Since the gene is recessive, many people are not aware that they are carriers for the gene. However, they can find out if they are through genetic testing. Since the sole cause of cystic fibrosis is genetics, the one and only risk factor for getting cystic fibrosis is having both parents who have cystic fibrosis or are carriers for cystic fibrosis. On the other hand, if you have one parent with cystic fibrosis, you have the ability to become a carrier, and if you also marry someone who's a carrier or has cystic fibrosis, then you have the potential to pass on the disease to your children. In addition, this does mean that there are no preventive measures that you can take in order to prevent having cystic fibrosis. It is something you are born with or you are not born with. Symptoms can include blocked small intestine from the problems of the digestive system, salty sweat or skin. And an interesting story I have is that I knew a doctor who knew a woman that she had cystic fibrosis and she could tell if her babies had it just by kissing them. She could taste the sweat. Also odd appetite, weight loss, again, due to the digestive system problems, low energy, resulting in getting tired easily, having odd bowel movements, including diarrhea and constipation, and then problems involving the lungs include wheezing, chronic cough, breathing problems, and then also reproductive problems due to the mucus. Over time, symptoms can become worse, and the chronic cough can produce mucus that has blood in it, and low energy can cause the sufferer to not be able to partake in exercise and other physical activities. A diagnosis for cystic fibrosis involves two different types of testing. The first part, which you must pass in order to go on to the second part, is either early symptoms that are shown at birth, if one has a sibling with cystic fibrosis, or if one has a positive newborn screening test. Every infant in the United States is tested for cystic fibrosis, so if they were to come back positive, then they would go on to the next type of diagnosis. The other type of diagnosis can include a genetic test which shows two defective cystic fibrosis transmembrane regulator genes, so the two genes that are inherited, and this can be done through either a blood test to the individual after they're born, or it can also be done prior to birth if they think they will be at risk of cystic fibrosis, and that can be done through a sample of the amniotic fluid, which can be done through either cryonic villus sampling or amniocentesis. Another option is taking two sweat tests, but they must be performed at different dates. The sweat test determines how much salt is in an individual sweat, which, as we know, is a common symptom of cystic fibrosis. Lastly, the last test that can be used for final diagnosis is an abnormal result on a nasal potential difference test, which uses electrodes to see how salts move in and out of the cells. There is no cure for cystic fibrosis, however, it can be treated. There are a variety of treatment options available for those with cystic fibrosis. Since the lungs of the individual often have thick mucus, respiratory therapy is used in order to assist with breathing and trying to decrease the amount of damage that is being done to the lungs, which results in there being less chance of infection and also rids the lungs of the excess mucus that may be bothering the individual. Since those with cystic fibrosis also suffer from digestive problems, digestive therapy is another common form of therapy. Digestive enzyme therapy does what it implies, and it replaces the enzymes in the digestive system, and this can help with the absorption of vitamins and minerals that the body is consuming. In addition, the body may struggle to absorb nutrients, so nutrient therapy can be used to replace lost nutrients, and this can be done through high-calorie diet or stomach tube feeding. Lastly, intestinal blockage can be a problem, so stool softeners or enemas can help relieve the blockage. Cystic fibrosis can also be treated with the help of medication. To treat infections, which are commonly in the lungs for those with cystic fibrosis, antibiotics are often used. For opening lung areas and also continuing to keep them open to help the individual breathe, vasodilators and anticholinergics can be used. Surgery in itself doesn't treat cystic fibrosis, but it can be used to treat some of the issues that may result from cystic. Surgery options can include a lung transplant if one is suffering from lung disease, a chest tube drainage if one has a collapsed lung, an intestine repair if one has a bowel obstruction, and a removal or endoscopic surgery if one has nasal polyps. The life expectancy for people with cystic fibrosis is fairly low because the disease worsens over time and eventually the organs will become damaged. In particular, the lungs become extremely damaged, and a majority of people with cystic fibrosis will die from lung disease. However, life expectancy is increasing due to technology and other medical advancements that can help with treatment and early diagnosis.